Nunkari Nungi, everyone. Nanawa Michi Paul Worley, Napi Puri Maori, Pomerangunk, Narajari Rui. G'day. My name is Paul Worley. I'm the Executive Director for Clinical Innovation here in the Riverland Academy. I'm working on beautiful Narajari Rui, Narajari country, here at Murray Bridge, Pomerang in Narajari. And using language as a reflection of the heritage that we are privileged to inherit from Aboriginal people and the opportunity to work with them now to provide further healthcare that's been going on here for 60,000 years. These grand rounds are an opportunity to learn at the cutting edge of what's happening in health service research around the world. And we're privileged today to be able to hear what's happening in our backyard here in South Australia. As you'd recognise, as a rural health service that's investing in research, we want to see a return on investment for our communities, for our patients, for our clinicians in that research. And so inevitably, we want to focus on ensuring that research is translated into outcomes, into impact. And that is what we're going to be hearing about from today. We have the privilege of Tom Symonds, the CEO of Health Translation SA, someone who has worked in the research areas in universities, has been a CEO, general manager of a health service, both here and in the United Kingdom. So understands where we're coming from and understands where researchers are coming from. And it's a privilege, Tom, to have you here to speak to us today. We look forward to hearing you talk about something that I know you're very passionate about. So over to you.
Many thanks, Paul, and good afternoon, everyone. It's lovely to be joining you. So, Nainari Tom Goodnicha Symonds. I am, as Paul said, the Exec Director for Health Translation SA, and I'd also like to just start by acknowledging the many traditional custodians on which the RMC LHN is located. I spoke before in some Ghana language as I acknowledge the Ghana people as the traditional custodians of the Adelaide region on which I was born, and my family now lives and works. And I certainly pay my respects to all First Peoples connections with their land and waters, and honour their elders, past and present, and pay my respects to any Aboriginal and or Torres Strait Islander colleagues joining us today. So, Marnie Nabudni, it's great that you're all here. I was just saying to Paul, I'm conscious that some of you may have heard from my predecessor, Wendy Keach, a little while ago, back I think the end of 24, about Health Translation SA, and indeed my colleague Drew Arras from our neighbour Research Translation Centre in West Victoria gave a grand round last week. So some of you, I don't want to overlay too much of what you might have heard before. So I'll sort of just briefly cover today a bit about who we are, HTSA, but more really want to focus on what we plan to be, and in particular what we plan to be in support of yourselves and colleagues across the regions in SA. And as Paul said, my own professional journey through health and university management and governance and research and innovation support has all been about partnerships and shared goals, and that's something I hope is a hallmark of HTSA going forward. So just make sure my slide moves forward. There we go. So just briefly, for those that aren't aware, Health Translation SA, or HTSA, is South Australia's NHNMRC's accredited Research Translation Centre, or RTC. And we came into being, firstly, was accredited in 2015 when I was working with Paul at Flinders at the time, and we were one of the first in the country, in fact, to be accredited, and there are now 12 such centres across Australia. HTSA is an independent membership organisation with a very clear statewide, SA-wide remit. Just going back a step, for those of you that don't know or not sure why RTCs exist, it is really simply to improve the health and well-being of patients and communities through the translation of research into healthcare. And that is three major parts of that. That's around strengthening the collaborations between health services and research institutions in particular, promoting health service leadership in research and its translation, and providing training and education to build research translation capability and capacity. So collaboration across the SA health and medical research ecosystem is obviously key to our success. Hence why HDSA has these partners you see on the screen, and these are partners that currently that provide the funds by which we do the things that I'll cover in a bit. But I think a pause for reflection in as we look forward in this, and when you consider that two of those objectives I just talked about for RTCs are around collaboration with health services as well as health service research leadership, that even though you can see there that we have the Department of Health as one of our members, there, in my view, there is an essential missing number of component parts here, which of course is the local health networks. And in fact, we are the only RTC like that. There's a history to that, which I haven't got time to go into today, but it is something that I'm really keen that we address going forward, that, you know, LHNs are absolutely pivotal to the work of Health Translation SA and pivotal to the benefit that we want to bring to the communities we all serve. So just briefly on our current plans, just to highlight our current strategy for Health Translation SA, which really is all around delivering on our purpose, which is to strengthen collaboration and capability to support the translation of research into real-world impact for the health and well-being of all our communities in South Australia. As you see there, we've got essentially three focus areas, one being addressing the priorities facing health services through collaborative research, implementing research translation across our health system by removing the barriers as best we can, optimizing the system, and thirdly, by giving our people the tools and support they need to drive outcomes. And for each of these, hopefully, I'm not sure how clear that those boxes come through, but you can see some examples there, and particularly the health service projects at the top box, the blue lozenge. You can see that there are projects that are various and programs, parts of the implementation pathway, from the work that we've started doing about implementing a lived experience peer workforce framework in a public hospital mental health service, with a view to scaling it up across the whole system, right through to the end stages of a 10-year research program to transition the omega-3 test and treat program to reduce preterm births into everyday prenatal care in South Australia. And that is really well progressed, and I'm very happy and humbled to chair the transition committee for that. So the whole spectrum over obviously a longitudinal period is something that the Health Translation SA is committed to supporting. With regard to the regional, rural and remote, or Triple R community, really pleased that my team are involved in projects such as supporting the equitable cancer outcomes across rural and remote Australia program. And also we support things like the SARI this year, the SARI 2026 conference, and helped on the organising part of that. Agustina is one of my colleagues who's joining us on this session today, created a panel session on that as well, and we really look forward to the next RIPA conference and being a big part of that as well. So that networking, that community of practice that we all know how important that is, very much part of our raison d'etre as well. So let's just have a look at some of the bigger picture stuff that's going on. And this year there's been a significant change in, if you like, in the landscape, and there are a couple of really important documents that really do genuinely herald, I think, some really exciting opportunities for SA and particularly for the SA Triple R Health and Medical Research community. So we've had both the National Health and Medical Research Strategy, 10-year strategy released, well, in fact, gone to government for response, but has essentially been released. And I know quite a few people, I'm sure, have been involved in were involved in the development and consultation of that strategy. And with that, we've also followed on from that. The NHMRC has just recently released its 5-year research translation plan, and in both of those documents, the regional, rural, and remote community is clearly identified as what's described as a priority population. So there's a lot that you can see in particularly in the national strategy around the regional, rural, and remote research agendas. And it is fantastic to see there is a certain thing called race that has appeared as a case study in that strategy. So that's an amazing commendation for everybody involved in RMC and race for the reflection that it gets in that strategy. The pleasing also headline for us, for RTCs, is that we are expected to be now supported through accreditation and funding to embed greater health service-led research and to drive health service research culture, translation, and impact. But there is a big focus in these strategies on the place-based regional, rural, and remote research. And just to highlight, you won't be able to see that, it's just up for just to show that there's a Triple R implementation guide even as part of the national strategy, which you haven't seen yet. I would commend you having a look at, and just to highlight a few of the sort of examples of what's to come. There's talk of a rural health innovation hub co-designed by rural health researchers. They're talking about expanding the Triple R clinical trials networks and teletrials, expanding research workforce capacity amongst clinicians in Triple R regions through some new dedicated incentives, such as fellowships, particularly to allow for protected time. They talk about ensuring the infrastructure roadmap ensures resourcing for Triple R researchers and healthcare, and incentivize collaboration to improve accessibility. And then one last example, they to build capacity and capability of Aboriginal and Torres Strait Islander and rural and regional and remote researchers to ensure community-led and culturally responsive research translation through new funding opportunities. So, and there's a whole list of other ones I haven't have got time to go through, but lots coming our way. But I suppose the key message now is that we need to, from an HDSA perspective, lean into helping build the connectivity and capacity so that our regions really do take advantage of what it looks like will be coming over the hill over the next few years in terms of some additional funding in particular, which will be very welcome. Just to therefore talk about how this is now reflecting in how HDSA wants to focus going forward. And really there's three key aspects to that. And one is obviously, as you've heard me say a number of times already, around how we really do focus on the health service connectivity and really have a really clear understanding of what are the service and therefore its communities that it serves, priority-driven research programs that we need to be supporting. And really how we use our collective efforts to strengthen clinician research, particularly the early and mid-career researchers and the leaders of the future. We obviously have a role to ensure as the system is greater connected, and by which I mean particularly, as I've talked about, the connectivity between research institutions and health services, but also particularly between the various care sectors, whether that be tertiary, secondary care, primary care, aged care, disability services. There is a huge amount of incredible translation research capability in South Australia that with even greater connectivity could do some quite profound things for our communities. That we need to think in terms of both the metro to Triple R community, but also the connectivity between the regional LHNs, where we can help with that process. And I'll talk about one particular development in a minute before my time runs out. That's hopefully is a big part of that. And we are definitely wanting to see how we can be an ally to the community voice, being that of the broader community, as well as for Aboriginal health research. And was very humbled and proud the other day to be a signatory to the new Aboriginal Health Research Accord, which is very much about principles into action that certainly is going to influence the way that we work and think. Our capacity building work is the other third arm of our value add, if you like, and particularly around research translation skills for researchers themselves, around the leadership and the championing of research translation, and also just generally the wider research translation support that our team provides. Currently, I would love to be able to clone and provide that support in a much more distributed way on the ground in the regions, and hopefully there is some opportunity to do that. So one of the things I mentioned is to be able to have that focus. We need very clearly to be able to hear the voice and listen to the needs of the region Triple R Health and Medical Research community. So we are proposing at the moment, and just had great conversations through the regional LHN research collaborative body to set up an advisory group to really, as it says there, to help shape the programs of HTSA, to identify opportunities for research support, the gaps that clearly that we know are there, and the challenges that we know are faced by low-resourced health services, as well as connectivity with research institutions, particularly looking at supporting clinician researcher capacity and capability, really growing as much as we can those clinicians in regional areas through a pathway of research skill development, and essentially provide a stronger connectivity and networks of support. So what we would really look to do is, when we look at I'll come back to our team in a second, we look at the types of things that we are involved in and that we deliver to all the community. One of the opportunities with that group I was talking about just then is to see how we make these activities more relevant and accessible for regional, rural, and remote research and researchers and clinicians interested in research, and anybody interested in research, to be honest. So if I just go back. So please, if you're interested in being part of this community conversation, please get in touch. Would love to have as broader a group of individuals. It will probably be a sort of quarterly meeting with a reasonable sort of high-level work plan, but it's going to be an incredibly important, I think, in terms of making sure HTSA is really shaped and listening to what's the needs of the regional research communities is. Just briefly to say who we are and from the team. Agustina, who's on the line today, is particularly our regional, rural, and remote link in terms of our new way forward, and has been leading a lot of our capacity building programs and our implementation science network program. So she will be somebody hopefully that you'll, if don't know already, get to know even better. And Beck Perry also, many of you may have come across Beck. She is our partnerships and impact lead, very strong, passionate for regional rural health as well. Then just just finally finishing off, as I said, we are keen to look at how we deliver and develop our programs in the future. One thing to highlight, we also want to we're about to review our Spotlight series. We are planning a Spotlight series, which is a webinar series, a deep dive into an area of research translation around primary care research. And then following from that, I'd love to be able to also develop one around regional rural remote research. And again, hopefully the advisory group will help us steer on that. And our Catalyst program, many of you may have heard of it. One of our previous winners, you probably saw in the photo early on, is the gentleman who introduced me earlier on, our seed funding program, philanthropically funded. We are refreshing that with a program of more tailored support for individual researchers and research teams, with a blend this time of larger implementation grants as well as a smaller micro grants to really kickstart research, including now a pathway to a first publication as well for grant success. So really excited about that. So just stay tuned for that. That will soon be announced, and we would love to have as many applications coming in from yourselves. And that is about it. I guess really to conclude, and please, I know these slides will be on the record, so please, the QR code to connect with us, sign up to our newsletter. At the end of the day, HTSA's I think value is as an engine, if you like, across South Australia for seeing research turn into real world health impact, and that's why its independent and collaborative construct is so important, because it enables research translation across the health system, including regional, rural, and remote health. And so that's that health system connectivity with yourselves that is so critical for that impact to be realised. And I'll pause there. Thank you, Paul.
Thank you, Tom. Huge amount of work going on, and I think what came through to me was the values that are in HTSA of collaboration and impact and listening. So if there are people here today who have listened to what you've said, or are listening to this in the future on the web, what's your understanding? What's the feedback that you've had up to now of the barriers and obstacles that rural communities and rural clinicians face in terms of research translation, and I guess how at the moment is HTSA looking to address those things? I know you've got some future plans, but what do you think is happening at the moment?
Yeah, I guess it does. The messages we get from the connections that we do have with those that are based in regions, or those that are doing research in regions and rural areas, is it is obviously there's a huge constraint around time and the availability to be able to dedicate time, particularly as developing your professional career in a clinical sense, is that there is less fat on the bone in many employment settings in regions to be able to explore that. There's less opportunity sometimes to connect with others that you can share that journey with. And there's I imagine a degree to which the sort of context of how health services are delivered in regional, rural, remote settings is obviously so very different from the sort of the predominant voices, if you like, the traditional voices of metropolitan-based universities and research institutes and health services. That there is, I think, just sometimes an accessibility issue into the sort of what might be seen as the sort of mainstream as well. So that's why I think the point around connectivity is so important. Yes, we definitely need to be able to advocate for greater investment as well. There's no getting away from the fact that, with the right type of investment, I certainly feel that, the bang for the buck, the return on investment, as you described it, Paul, in triple R health and medical research is exponentially a higher curve than it is in the sort of sometimes black boxes that are large university and health services in metropolitan areas, and the connectivity with community is so much closer. I think that with some of that connectivity, some of that targeted funding, and some of that capacity building and leadership that we talked about, I think things could progress way quicker and way further. I know that innovation in healthcare is standard stock in low resource settings. There's the same, I think, can be applied to how research and impact of research could be seen to happen as well.
I love the way you turned my question around from being what are the problems to what are the strengths, because I think that is actually one of the answers to overcoming the problems is recognizing what are the strengths and the opportunities that rural communities and rural clinicians and health services bring to the table. Very encouraged to hear that. And your articulation of the time issue, I think, is spot on. My sense is that that's a societal issue as much as anything. I think we're all feeling short of time in all our roles in society at the moment, but particularly for early career clinicians, that is very difficult when you're trying to create your life and your career and further qualifications to be able to have time to have that thinking time that's absolutely key in research. And it is something, for people in RMC, it's something that we are supporting policy-wise of finding ways that we can support you with time for productive research that's making a difference in our region. So we certainly have recognised that. I also want to acknowledge two of my colleagues on the grand round today who are here specifically to support clinicians in creating greater access for their patients to clinical trials. You mentioned the Teletrials Initiative, and Irene and Julia are here, and others in our LHN may not be aware that they are based in Murray Bridge and Berry to support clinicians providing that access to clinical trials for their patients. Clearly, they only have two hands, so that's and they're only two people. But I think that is an indication that we're looking to invest in providing that sort of capability. You mentioned quite a bit of training that HTSA is involved in. If a person didn't know much about it but can see that all makes sense what Tom said, I'd love to get involved. What sort of training would you suggest they access first up, just to dip their toe in the water, if you like, and start engaging with HTSA?
Agostina, I don't know if you're able to join the conversation, just if you're there. If not, yeah. So, look, I think the easy way in, obviously, with a number of our sort of resources that are online, both that have been previously recorded, our Spotlight series, our stuff that's online. There is there we go. Agostina, I don't know if you wanted to sort of, you're way more the expert, and wanted to just reply to Paul's thoughts around how people, what's the entry point for, learning more about research translation that in your experience has been really helpful?
Well, there's quite a few entry points. So you did mention our Spotlight series, which are a series of webinars are published on our website. So that's, I guess, that would be a first point of call. Just access our website, look at all the different topics that we've explored. Each series or each topic has 4 webinar series. So it's really a deep dive on specific translation topics. We have a professional network around implementation science. So we meet 4 times a year. It's a little bit like a community of practice. So if you're interested or running implementation projects or even just starting in the field, it's a great opportunity to come and meet others in the field and learn about other projects, implementation projects. And we also have workshop activities to get our hands dirty with implementation frameworks and all that. And we have specific courses as well. So we do lots of work at HTSA around consumer and community involvement in research. It's increasingly an expectation from funding bodies to involve the community, to inform the research that we do. And so we want to ensure that it's done right in a meaningful way with purpose. So actually, our next consumer and community involvement masterclass is on Monday next week, and it's, I think, sold out. But we run that twice a year, and we can also do a bespoke CCI masterclass. So we're running one at Flinders in November. And the last, I guess, flagship course that we run is the Research Translation Essentials course. So that runs over 2 days. So it really is a deep dive across different areas of research translation. And it's each module is presented by a leader in the field. So we explore co-design, consumer and community involvement, implementation science, health economics, all things that you really need to consider to ensure that your project gets translated eventually. So those are a few of our key capacity building initiatives that we do.
Thanks, Tom. Thanks, Augustina. Some people on the call may say, well, I don't think I'm a researcher, but I really am committed to quality improvement and quality improvement projects in the particular area that I work in. How does HTSA interact with people who they see ideas from elsewhere, and how can I implement that as a quality improvement project? Do you have a link in for people who are thinking like that?
So my quick response to that, Paul, is one of the things that Agostina's talked about, which is the implementation science network, which sounds very highfalutin. It actually is a genuine, community of practice around improvement and research implementation. So when I've been to those sessions, there are people that are essentially presenting QI programs as well as formalized research programs. So that would be absolutely one. I think the other would be, the opportunities for that we're looking to do through our support networks to the other LHN's research symposiums and days. So we're picking up now and putting some money into supporting, and like I said, we're keen to work on the race one and the RIPA conference as well, but providing some awards and some publicity to those that are doing fantastic QI related projects that go on to become more formalized research. Because I think some of those amazing, the motivations and ideas come from those things that people see on the ground that need to be improved, that then might become something even more significant. So we'd be happy to share those connections as well with others through our various portals, so that people can say, oh, that's the sort of thing I'd love to do. Can I talk to them? That is as powerful as it is a formal training course.
That's so encouraging. So I hope everyone who's listening hears that encouragement, that if you have an eye for improvement, that the skills that are being talked about in terms of implementation research are very much skills that can help you in your quality improvement projects. And everyone would know in RACE and RMC that there is a very strong emphasis on quality improvement and encouraging people to see ways that we can do things better so that our community gets the benefit. So thanks for that encouragement, Tom. Thank you, Augustina, for your contribution as well. And it's been a real eye-opener, I think, to see the extent of work and the extent of willingness to collaborate. And we look forward to doing that more and more. But for our grand round today, people need to get back to their clinical work. So we'll formally say Ananingi. Thank you, Tom. And Nakan to you all. We will see you again at our next grand round, where we will learn more about how we can make our services better for our communities. Nakan.